Good day, I'm Dr. George Maravillosa, a pediatric pulmonologist, and we will be talking about tuberculin skin test, its procedure, and interpretation. At the end of this session, our objective is for you to apply and demonstrate the procedure of the administration of tuberculin skin test and be able to interpret its results. This will be the outline of our topics. First, we shall have an overview and rationale of tuberculin skin test, its procedure, the interpretation of the result, and to cover slightly regarding special considerations of this test. Since its discovery more than half a century ago, the tuberculin skin test, or TST, is still the most widely used method to demonstrate TB infection. As one of the 5 criteria set by the Philippine Pediatric Society, it has an integral role in making a presumptive diagnosis of TB in children, in the absence of bacteriologic evidence, which remains to be the gold standard. It is an important tool in TB control and prevention. Recognition of latent TB infection, or LTBI, which means TB infection without the disease, helps decision making for preventive chemotherapy, especially in the under 5, before the infection progresses to TB disease. LTBI in the young is also considered as a sentinel event, reflecting recent transmission. Thus, the TST is an important epidemiological tool for tuberculin surveys in assessing the annual risk for TB infection. The rationale behind this tuberculin skin test is that tuberculin reactivity provides a general measure of a person's cellular immune responsiveness. It is based on the delayed cellular hypersensitivity to certain antigens of the TB organism contained in the extracts of cellular filtrates known as tuberculin. The delayed hypersensitivity reaction is manifested clinically as a type 4 immune response mediated by lymphocytes and is characterized by an indurated response to the intradermal injection of protein from the cell wall of the tubercle bacillus. This delayed type hypersensitivity response to tuberculin is detected 2 to 12 weeks after infection. In most children, the estimated interval between TB exposure and detectable skin test reactivity ranges from 2 to 12 weeks. According to the Center for Disease Control and Prevention, they recommend TST in individuals with history of contact with an infectious source between 8 to 10 weeks after the most recent TB exposure, and if the initial test result is negative among individuals with history of contact with an infectious source. While the Department of Health National TB Program recommends a repeat TST at 3 months after a negative TST in a TB symptomatic child, or 3 months after a negative TST in children 4 years of age and below. Let's now proceed with the procedure of the tuberculin skin test. The MANTU test is the standard and recommended method of giving the tuberculins for TB screening. It employs an introduction of a small amount of tuberculoprotein, or the purified protein derivative, or PPD, into the intradermal tissues with a small gauge needle. The generalities regarding procedure of tuberculin skin test is that it starts with the preparation of PPD for MANTU tuberculin skin testing. This is used for most skin testing as it is isolated from the culture filtrate by protein precipitation. The standard dose is usually 5 tuberculin or 5 TU units. For the administration of MANTU TST, it is usually located 2 inches below the elbow joint in the volar aspect of the forearm, given intradermally, while the reading and recording of the MANTU TST is by the induration that is read in millimeters using a standard ruler between 48 to 72 hours after administration. The next couple of slides are video presentation of the actual procedure of TST. Just like any other procedure, we need to explain this procedure of tuberculin skin testing to our patient and to their relatives and get their consent. These are the materials to be used. On your left shows you the PPD reagent, the ruler, ball pen, and the recording sheet. On your right shows you the alcohol, cotton, and the gauge 25 to 27 TB syringes. To start with the administration of this test, locate the site of injection about 2 inches below the elbow joint in the volar aspect of the forearm. Clean the preferred site with alcohol swab and air dry. For one-time tests, use a disposable tuberculin skin syringe with gauge 25 to 27 short bevel needle. Aspirate 0.1 ml of either the 2-TU PPDRT or the 5-TU PPDS, which is commonly used in our country. Then, inject intradermally. You should note a pale wheal of 6 to 10 mm in diameter that should be evident after injection. Otherwise, repeat the test on an area at least 2 inches away from the original site. After the PPD administration, untoward reactions to tuberculin are uncommon. Some delicately sensitive individuals may have vesicular or ulcerating local reaction to skin testing. Much less encountered are regional adenopathy and fever. Subjects are advised not to scratch or apply any ointments or cream or pressure on the injected site. After this, advise them for follow-up and come back to your clinic after 48 to 72 hours for the reading and recording of the test result. With regards to the reading and recording of the TST result, it should be read between 48 to 72 hours after administration. A positive TST reactions can be measured accurately for up to 7 days, while negative TST reaction can be read accurately up to 72 hours only. Remember to read the result under good lighting. Visually inspect the injected area for any reaction to tuberculin, which is the induration, a palpable raised hardened area, and not the erythema. The diameter of the indurated area should be measured across the forearm perpendicular to the long axis. Using your fingertips, palpate and locate for the widest diameter of induration and mark for both edges. This is by the use of the ballpoint method as shown in this slide. Now, with a standard ruler, using the millimeter part, place the zero ruler line inside the left dot edge and read the ruler line inside the right dot edge. Remember again that the size of the induration should be recorded in millimeters. If no induration is found, put 0 mm and should be recorded. Do not record as either positive or negative. This is a sample of the tuberculin skin test form wherein details of the procedure that was done and recordings will be filled up. Now let's proceed with the interpretation of tuberculin skin test results. To discuss this, we should talk about the recommendations for the positive cutoff size of the Mantoux TST and its factors that may affect the TST reaction either as false positive or false negative reactions. Regarding the recommendations for positive cutoff size of the Mantoux TST, a 0 to 4 mm means a negative reaction, while 5 mm or more is considered for patients who are immunocompromised, with HIV, exposed to an active case of TB, and with chest radiograph suspected of tuberculosis, while 10 mm or more are considered for patients who are children less than 5 years of age, living in areas with high cases of TB, with comorbidities, or workers in areas dealing with TB. These are the factors that may cause a false positive reaction, such as an infection with non-tuberculous mycobacteria or having a reaction due to a BCG vaccination. While factors that may affect the TST reaction that cause false negative reaction are as follows. If it is related to the person being tested, he or she might have this following conditions such as previous viral infection, previously given live attenuated viral vaccines, have metabolic derangement, nutrition problems, disease affecting lymphoid organs, immunosuppressions, the extreme of ages, and undergoing stresses. Those that are related to tuberculin use might be due to the improper storage, improper dilution, chemical denaturation, contamination of the reagent, and absorption into the syringe, while related to the method of administration is either due to the injected too little antigen, delayed administration, or too deep injection, while those related to error in reading and recording of the results might be caused by an inexperienced reader, bias, or error in reading. For special considerations, we talk about first about anergy, which means the inability to react to the tuberculin skin test because of weakened immune system. While the next special consideration is regarding the boosted reaction. This can be found for some people who are infected with M. tuberculosis, and a delayed type hypersensitivity to tuberculin may wane over the years. While the last special consideration is about skin test conversion, which refers to a change from a negative to positive result indicative of a recent infection with M. tuberculosis. These are my references for this lecture. We'd also like to acknowledge our residents for helping me with this presentation. Thank you for listening.